So think about that entire experience, not just from your door in, start to think about your door out. So today's question is a really long one, but it's a great one. It says, should I be showing through my social media pages what we are doing to keep safe and respect the mandated guidelines for disinfecting the office while keeping, obviously, our urgent patients safe, but now reintroducing the elective patients? I think absolutely. I think it's a great way for you to showcase exactly what you're doing to make your patients feel comfortable. But remember, people who have followed your social media usually are people who have experienced your brand before. So it's not necessarily for new patients. So when we're thinking about elective procedures and we're thinking about new patients coming through the door, we have to be able to showcase that as well. So maybe doing some advertising around placement of ads showcasing what you were doing so new eyes are seeing it, as well as reassuring your existing patient base about what you are doing when they walk through the door. The other thing that I've been thinking about a lot is most people are showcasing what they're doing within their practice, but think about the experience of the patient the minute they leave their house. They're going to be, obviously they get in their vehicle, they go to the facility, there's parking arrangements, they might have to walk through a foyer, you might be in a building with other businesses. So think about that entire experience, not just from your door in, start to think about your door out as well, your door to the patient's door, and really giving them that experience, that comfort level all the way through. And you can start doing that, obviously, with your existing patients, people who are about to turn up to surgery, people who are about to turn up to consultations. You can send them information, show them pictures about what you're doing, how you can be safe, how you can differentiate just a little bit. There's a lot of things that are super standard. We're seeing people in masks all the time, but just, I think, try and bring your brand to it and do that external reach. A big differentiation point will be if you get to the patient and say, we are wanting to give you the safest experience from the moment you leave your house. These are the guidelines we think you should follow when you turn up to our office, and from the office through to our front door, this is kind of what we're able to facilitate. These should be the guidelines. This is how we're caring for you, and kind of extending that reach out to them. I think you'll start to build more and more trust, even though you have trust with your patients. And then if you can showcase that to new patients with some ad placement, I think you'll be golden.